everyone. Thank you so much for joining. Tonight, we are going to be talking about connective tissue disorders and what it is like to live with one. My name is Morgan. I am one of the presenters here at Invisible Illness Awareness Network. And I am a white female with dark brown hair, and I'm wearing a blue shirt. Alrighty, so what is Invisible Illness Awareness Network? We are a 501(c)(3) nonprofit raising awareness about invisible illnesses, chronic illnesses, and disabilities. IIAN supports students starting affiliate organizations to become leaders, educate their peers, and foster inclusive environments at their universities. And what is the Invisibly Aware series? That is what you are at right now. This is a Zoom session that we hold once a month, a virtual event featuring guest speakers who will share their lived experiences or professionals who will talk about their expertise on the topics. And a couple of important disclaimers. We just want to make clear that this is not any medical advice. If you do have any concerns or questions, please consult a doctor. And then everyone who does have a condition can be unique. So even people who have the same diagnoses might have different lived experiences or different symptoms. So we just ask that you respect that as well. And then lastly, we are not experts on our topics, but our guest speakers are experts on their own personal experiences and their bodies. So again, we just ask that you respect them as well as their expertise in that regard. Alrighty, and so now just to jump into a little bit of background before we hear from the speakers, we're going to talk again just briefly about connective tissue disorders in general. These are a group of conditions that affect the tissues that support and hold the body together. So connective tissues provide structure, strength, and protection, and they are found throughout the body in several areas, including skin, tendons, ligaments, organs, blood vessels, joints, and more. So connective tissue disorders kind of can affect everywhere in the body. One of our guest speakers tonight has Marfan syndrome. This is a genetic disorder that affects connective tissue across multiple systems, but specifically the heart, the eyes, the blood vessels, and the skeleton. 75% of people with Marfan syndrome inherit it genetically, and this is a variant that is inherited from at least one affected parent. And then other people can develop it spontaneously. Common features for Marfan syndrome include a tall, slender build, disproportionately long limbs, heart murmurs, extreme nearsightedness, and scoliosis. The incident rate for Marfan's is 1 in 3 to 5,000 individuals, and then treatment often includes blood pressure lowering medications, scoliosis treatment, eyeglasses, or eye surgery. And next, we have osteogenesis imperfecta, or OI. This is a genetic disorder that makes bones very fragile and prone to break easily. OI can also also affect the body's ability to make collagen properly, and collagen plays a very important role for the development of skin, bones, muscles, and tendons. OI also consists of various types, which vary based on the type of inheritance. So there can be differences in the presentation of the condition as well, depending on the signs and symptoms. Um, if the cause of OI is also, again, genetic, the body is not able to make enough of the collagen, or the collagen that is produced is made incorrectly, causing these issues. The alterations in the genes can be inherited by one or both parents, or in some cases, it can also arise spontaneously. For symptoms, patients often present with broken bones, curved spine, hearing loss, muscle weakness, difficulty breathing, and bruising easily. The prevalence is 1 in 15 to 20,000 births, and treatments often include bone strengthening medications, physical and occupational therapy, mobility aids, and dental care. Wonderful. Well, I'm going to go ahead and hand this off to Stephanie to introduce our guest speakers.
Hi, everyone. I'm Stephanie. I'm one of the co-founders and co-presidents of Invisible Illness Awareness Network. I'm a white woman with medium-length brown hair, and I'm wearing a gray blazer and a black shirt. So tonight we have two wonderful guest speakers joining us tonight. We have Christopher, who is at CPIKO Art on Instagram. They're an artist and Marfan syndrome advocate. And we also have Michaela, who is at Fun Sized Style on Instagram and YouTube. And I'll let them do their own visual image descriptions and introduce themselves a little bit.
Okay, I'm listed first, so I'll go first. Hi, everyone. My name's Christopher. I am a white man with short brown hair, very thick wire rimmed glasses, and a purple sweater. And yeah, I'm a 24-year-old artist and video editor, entertainment person with Marfan syndrome.
Hi everyone, my name is Michaela Dabert. I have osteogenesis imperfecta type 3. I am a white woman with short brown hair wearing a floral burgundy dress. As mentioned in the introduction, I do have OI and I'm excited to share about my experience.
Thank you guys so much for being here. We really appreciate your time. Um, so you introduced what you have. Could you share your experience with living with your condition and things you might want to talk about regarding that would be like when did you start experiencing symptoms? What symptoms do you have? Just a general brief description of how your condition affects you from day to day life.
So as mentioned in the introduction as well, osteogenesis imperfecta is a condition that you are born with. And so I don't know any different what life is like to not have a physical disability. OI is very unique in the fact that there's so many different types that are being discovered. There are over 20 different types now. I have type 3, which is the second most severe type, so it obviously affects my height. I'm only 2 feet 6 inches tall. My family also has OI. My mom and my twin brother both have osteogenesis imperfecta type 3. So I inherited it from my mom. But in the case of her family, there's no one in her family with OI. It was considered a spontaneous gene mutation. I've had over 100 fractures throughout my lifetime and 31 surgeries. Common uh, traits in OI in childhood is frequent fractures. There's also no cure or treatment for OI. Bone strengthening medications are marketed as a treatment for OI, but they don't treat the root cause of OI, which is collagen production. So I've actually never chosen to pursue those treatments. So I've mostly done surgical intervention when needed. I have titanium rods in all 4 of my limbs, as well as 20 pieces of hardware in my spine from recent scoliosis surgery. And so there's many different things that OI affects because collagen is so present in the body. And so you don't have it or you don't have enough of it or very good quality of it. In my case, my body makes enough of it, but what it makes is not very good quality. So that's what results in all these different health challenges. And even for my mom and brother, it presents a little bit differently in all 3 of us. So even within the same condition, the same family, the same type. It just varies so greatly, and I think that's what makes coming up with treatments for OI so challenging and why they haven't been able to do it yet. But that's a little bit about what OI is and how, I live such a fulfilling life with it. I work full time. I went to college. I have built a really great career and live such an incredibly fulfilling life with my disability, and that's something that's so important to me when I talk about it. Because when I talk about the medical side of it, it sounds really sad and scary, and it's definitely challenging. But again, I don't know life any different, and I thoroughly live a completely fulfilling life.
That's great to hear. Thank you so much for sharing that.
It's so interesting hearing about, having a completely different illness to me. And, I've never broken a bone in my life. I'm also 6'2", but I also was born with my condition. I was diagnosed at 18 months old. So I also have not known a life without disability. And I also love my life. I live a fulfilling life as an adult, went to college, and I'm currently at work right now. And my boss is letting me take this meeting in my super boss's office. But, yeah, so I, was not a conscious being when I was diagnosed at 18 months old. But, what I've heard from my mother is right out of the womb, I am the youngest of 3 siblings, and, the first thing my mom noticed when I popped out was my fingers were much longer than my other siblings when they were born. And when she pointed this out to the nurse, she goes, I was born in Tennessee. She goes, "Oh, it's totally fine. He'll probably just play piano." And, my mom, who is a very, confident and self assured individual, when she moved to a different place, she asked them, my kid, he's this close to the TV when he watches it, and whenever he throws tantrums, he'll put his legs in crisscross and lay back and scream in a way that her body and her other kids' bodies couldn't physically move, and that second doctor said, "It's fine, it's nothing," and this was in the early 2000s, and she moved to a 3rd place with my family, and only then, um, did she happen to run into an intern, at the Children's Hospital of Pennsylvania, or Philadelphia, whatever CHOP stands for. I haven't lived there in a while. But he was studying Marfan syndrome, and he recommended a geneticist who diagnosed me. And I wasn't diagnosed through genetic testing. It wasn't really widely available or affordable back then. But through just going down the checklist of symptoms, they determined I'm a very textbook case. I have 14 out of the 16 symptoms from Marfan syndrome. You only need 7 in order to achieve a diagnosis. Um, and the major ones, like I said, I'm very tall, I'm very thin, I'm 6'2", and 115 pounds. I was 100 pounds for or less for the first 20 years of my life and only recently cracked 115 after my latest heart surgery. I am also low vision. I'm visually impaired, 20/40 in my left eye and 20/100 in my right eye after correction. My prescription is -18 and -15, so visual impairment is a big part of my daily life. I also experience general fatigue from taking beta blockers. So I can't stand for very long periods of time. I have difficulty lifting stuff or carrying things long distances. Um, and I also had my spine fused. I was 13 when I had my spine fused. But the primary Marfan symptom that everybody freaks out about and that I have and have had corrected already is aortic aneurysm. So from a little kid, I had heart murmur, I had a prolapsed mitral valve, and I also had aortic aneurysm, which is when the root of your aorta is bigger than it should be. I got it corrected through a valve-sparing aortic root replacement in 2022, a few years ago while I was in college. And at that point, it was 4.8 centimeters in diameter, which is very big if you convert it to inches. That's almost 2 inches wide, which is at least double what a regular adult has. But yeah, I would say the biggest thing that affects me day to day is my visual impairment. Like I said, I'm employed, but I am a video editor, and if you were to sit next to me, you would see me still being extremely close to my screen as I edit, although I accommodate myself through uh, various MacGyvery ways, whether it be inverting colors to minimize light because I have sublux lenses in my eyes, which is part of what makes my eyesight so poor, as well as severe myopia, um, or enlarging text as high as it can go. So, there's no privacy in the office when you can see my text from all the way across the room. But yeah, I've been living with this illness for my entire life. I've always been aware of it, and I've always had to advocate for myself because part of the danger of Marfan syndrome is spontaneous aortic dissection. So all of my peers, all of my teachers, all of the parents of all the kids that I knew, my roommates, my friends, they all know what to do in a situation in an emergency, and I've always had to advocate for myself from as long as I've been conscious and had to talk. So, yeah, like Michaela said, it can be scary to live and be hospitalized a bunch of times. I've had sepsis, I've had a cerebrospinal fluid leak, I've had both of my both of my lungs collapse. I've had open heart surgery, and you know, however traumatic that may be, I wouldn't be myself without Marfan syndrome. There's no universe where me would be the same without it. So yeah, it can be scary, but uh, having these conversations and letting people know that this condition, however scary, is not a death sentence, and that you can live a fulfilling life is something very valuable to me. So I'm glad I'm here to talk about it.
For sure. Thank you for all of that background. Um, and you guys already kind of touched on this for some of our next questions, but like it's a little different than what I feel like we have a lot of people who have gotten diagnoses over time. Like lived a good portion of their life without having a diagnosis, but you guys both were born with your conditions. Um, so you can touch on a little bit maybe, like I know, Christopher, you said you were diagnosed at 18 months old, and it was an intern that ended up leading you to the diagnosis. Um, when you guys were younger, did your parents ever sit down and discuss your conditions with you? Like, what was your emotional reaction to learning about your condition as you grew up?
Yeah, for me, I don't think there was ever, like, a pivotal, like, time where my parents had to, like, sit down and talk to me and my twin, about it because, I mean, especially having a parent who also has this condition, like, I mean, it was literally ingrained in me from the moment that I was, you know, alive that, this is what I have, and because we don't know any different, like, this is our family dynamic. I have obviously always knew that I was different than everybody else, but especially obviously given my height. But other than that, like I I never felt like I was missing out on things in life. My parents have continued to help provide like an incredible life for me. But yeah, there was never a time in my life where I was like, man, like why am I so different, or why do I look like this, or why do I have to do these certain things? Like I've just always had that understanding like, innately, I believe, and so, though I never had that kind of, like, pivotal moment in my life where I had to, like, come to terms with anything. I've always just kinda done what I had to do to adapt to a world that is certainly not made for someone with mobility challenges, but, um, I continue to have to do that every day.
No, that makes sense. Thank you for sharing.
Yeah, I'd say I feel pretty similar. I do remember I did an art project once where I was looking through my old diagnostic papers that my parents had kept on these, like, old yellow pages from, like, 20 years ago, and I remember, a letter that I think the intern had written to the geneticist, and it was like, "This is obviously very difficult for the parents, but Chris seems to enjoy orange juice at the appointments, so we'll probably let him use orange juice for his medications." Like, from the very beginning, I think I seemed very unbothered by the situation. I was like, "Yeah, whatever," you know? But obviously, I forgot to mention I am a spontaneous case, so I'm in the 25% of the 1 in 3,000, um, Marfan cases that spontaneously present. I have no family history of it. Um, I'm the tallest of my mostly 5'7" family, and stand out in pictures for sure. But yeah, I think although I never really had like a I'm comparing in my head to like the birds and the bees conversation about my chronic illness with my parents. I definitely remember from a very young age the importance of, like I mentioned, like advocate for yourself because your life depends on it. So I think a difference between myself and a regular person is just being aware of your mortality from a very young age and just always being aware of, for example, like Jonathan Larson's story, the guy behind the playwright behind Rent who tragically passed away because his aortic dissection wasn't caught in the emergency room and he was sent home. And like my parents used to hand out flyers at productions of Rent when we lived on the East Coast, and, like, that's always been something ingrained in me that, like, if you feel that something is wrong, don't shut up about it until somebody looks into it, and that's obviously an attitude my mom had, or I would have never gotten my diagnosis in the first place if she trusted that first nurse who said it was fine. And the average age of diagnosis for Marfan syndrome is 19 years old, so I'm a very even rarer case of the symptoms being recognized, being apparent enough when I was a little tiny little apparently very long baby, so, yeah, I would say though, in terms of, like, emotionally connecting with that, I didn't identify specifically as disabled until I went to college. In high school, I had insecurities just like everybody else about, like, I'm not considered attractive because of my disability, the visible aspects of it, kinda make me an outcast. I've, of course, experienced bullying, staring, all the thing of people who have visible disabilities, and, at that time, people would ask, "Would you ta if you could take a magic pill, would you?" And at that time, I would say yes, but at this time in my life, I've done a lot of work to, like I said, know that the person that I am today would not exist without Marfan syndrome and the experiences that I went through. And in college, I went to UCLA, which, if you've never been there, is a very hilly campus with a lot of stairs. You physically can't get from one end of campus to the other without having to go up or down 100 stairs that can't be fixed through an elevator. So that was the first place that I was like truly not accommodated in a full way, to the point where a chronic illness that sure had me hospitalized, but wasn't affecting my day-to-day life, like, too much outside of, risk factors of, aortic dissection and eyesight. It became a daily challenge where I had to rely on other people and couldn't, get around in the same way as my peers on a very physically demanding campus, and my identity as a person grew, and I was very isolated as a freshman in college. And I was very lucky that at that time, um, somebody else with a different disability, she had cerebral palsy, was one of a few students who created the first ever disabled student union at that university. And without that, who knows where my self journey would be. But I would say, even if I didn't have that kind of switch as like sitting down and talking to me as a youngster, I definitely had a later in life, you know, not necessarily identity crisis, but a time where I really became in tune with what it means to be disabled, and how that impacts my life, and all that stuff. So, yeah.
For sure. It's definitely a growing experience and getting to, learn who you I mean, like, a lot of young adults try to learn who they are in college, period. And you get to know yourself more and what you like to do and all that fun stuff. But getting to know more and being more comfortable with your identity too is a big part of that. That kind of leads into some other questions that we have about challenges that you've experienced, whether it be in in the healthcare system, period, or in your education, workplaces in terms of support or a lack thereof. Things you might want to talk about are your experiences with schools, your workplaces, or um, just the healthcare system in general. And have you experienced stigma, discrimination, medical gaslighting, or accessibility issues? I know, Christopher, you just kind of talked on this. It was a perfect transition um, for your experience at UCLA. But if you have any other additional comments on that kind of thing.
Sure. Yeah. As I mentioned kind of in my introduction, the world is not built for someone who has mobility challenges. I use a power wheelchair as my primary form of mobility. I have never walked. And so the world, again, is not accessible and constantly having to adapt. And there's places even, I live in a smaller town. And so there's places even here that I can't access because they're not accessible. And gosh, in terms of gaps within the healthcare system, I feel like that could be an entire episode in itself. And I'm sure Christopher can relate. But I think the primary thing that I bring it back to when it comes to healthcare is I've been told by healthcare professionals that I should not have been born. And healthcare is caring for human beings. And when you don't value their life, why should I pay attention to anything else that you're telling me when you don't value the life of a human being? It's the most incredible gift is the gift of someone's life. And this life is so short and it's so precious, and every life deserves value and dignity. And to be told by someone who is supposed to care for the most vulnerable and the most like needy in that time to say that you don't matter, those words will never leave you. And to say that you're a burden in the world, like you don't forget that. And so I like one of my least favorite things to do as a patient is meeting a new doctor because I don't know their stance on human life. Do they value human life at every stage or just when it feels convenient to them or when it's their own family member? And so that's something that I've had to wrestle with in terms of navigating healthcare. In terms of accessibility, like I said, I graduated college. I got my bachelor's in business administration. I graduated with honors. I actually went to college entirely online. Even like pre-COVID, that was my plan. A lot of colleges around here are not accessible, did not have the resources that I needed to be fully immersed in the student experience. And so I chose to go the online route. But yeah, I work from home as well. So that's just kind of like what works for me. But yeah, like Christopher said, like constantly having to advocate. And I think mobility challenges are unique in the fact that until you live it, you don't understand what how limited you become in your own community when things aren't accessible. And disability is unique because it's the only minority group that you can become a part of at any point in your life. Like, it only takes a fall down the stairs or a tragic car accident to completely alter your life forever. And then in that moment, you're like, oh, I get it. Like, I have people in my own life who were not born with disabilities but have become disabled later in life. And they get a glimpse now into what my life has been like for its entirety. And it's a huge eye opener for you. And so it's just uh, disability does not discriminate, and it's can happen to you at any point, and that's why I advocate so strongly for universal accessibility because it truly is for everyone.
100%. You took the words right out of my mouth. I was so prepared to be like, disability does not discriminate against anything or anyone. Like,
Yeah,
you can become disabled at any point in your life. And that's something a lot of people, and like you said, a lot of healthcare professionals don't necessarily consider. And I just want to say, I'm so sorry that you had that experience. No one deserves to be told that. And
thank you so much.
people should not be going into healthcare if they have that attitude, in my personal humble opinion. But,
Absolutely.
we can have many a conversation about that, I'm sure. Um, but, yeah, thank you for being vulnerable and sharing that. That I really we really appreciate your perspective on that.
Thank
Uh,
you so much.
Christopher, do you have any comments?
Yeah, I'm very lucky as I've had the privilege throughout my life. I've moved a lot of times, as you could already kind of tell from the beginning of my story. And since I was diagnosed young, whenever my dad moved jobs, it was always had to be at a place that had premier top of the line healthcare, whether it be the Children's Hospital of Pennsylvania in the early 2000s. Don't know how they're faring now. Who knows? To when I moved to the Bay Area when I was in elementary school, and we were close to places like Stanford, who have really premier healthcare, and Kaiser Permanente at that point in Northern California was also a godsend. I was hospitalized many, many times when I was in high school. I was in my senior year, I was hospitalized in June, July, August, September, October, November, all for different things. And each of those emergency room and hospital visits cost like $150 because of the insurance that we were very lucky to have. So, I've been very lucky in that way to have access to really good healthcare. And uh, sometimes it's because I get to be the guinea pig. I'm kind of, as I said, a textbook case. So it's always like, hey, can I bring every medical student in the building in this room while we do your eye exam or your scoliosis exam or your heart exam? Who wants to look at Chris's echo? Who wants to get a taste of this rare disorder that you might never, see again and outside of your textbook, like we mentioned earlier. Um, so in that way, it is a little it's kind of funny, a little demeaning when you think about it, but it's also, sometimes it's like it's good that these people get to see these cases and hopefully leads them to being more humane about these situations rather than the opposite that Michaela experienced. Like seeing a rare case should lead you to, oh, there are people that live with this disability or illness. That should lead me to being a more knowledgeable and thoughtful and empathetic doctor versus kind of evil and non-empathetic and antithetical to what a healthcare provider should be. But in terms of socially, I experienced a lot of isolation as a kid. Like I mentioned, a lot of staring, which I'm sure Michaela you relate to too. Just like you know, it's so funny that something as silly as being the tallest kid in your class to an extreme degree can be something so isolating. And when you add in, the kid who has to skip PE because of physical reasons and kind of disappears with a care attendant instead, or why is Chris gone again? Oh, he's in the hospital for XYZ reason. And you kind of learn early on. I had my spinal fusion surgery when I was, I think, 13. I was in middle school. And, you know, when you're a little kid and you experience illness and you're in like a physical school, a lot of times people will send you get well soon cards and stuffed animals and balloons and flowers. And then, as a lot of chronically ill people can attest to, I think, once it happens again, that same support doesn't, it's kind of becomes not novel. And because your suffering is not novel, they're like, oh, well, he can live with it, whatever. People that you consider friends don't visit you. People who, claim to care about your well being don't show up for you because you become inconvenient. And that was an experience that I had when I was young and when I was in high school. And it's tough. A lot of people with Marfan syndrome have anxiety and depression, both because of our symptoms and because of how we're ostracized. And I've been very lucky. I'm a painfully positive person about my own situation. I was just telling my boss I have B positive blood, and I think it fits into the rest of my life coincidentally. And it's just because of that idea that you know the only other thing I can do is survive or die. And if I'm gonna survive, I might as well live the life that I want to live. And, I've always been told as a kid and even as an adult, how do you stay so positive? How is it that you feel so fulfilled and happy with the unfair cards that you've been dealt, as some people may put it? And it's just like, well, you know, I don't have another choice. And that kind of leads into what Michaela mentioned of people being like, if I were you, I would kill myself. If I were you, I wouldn't be able to live the way that you live. And it's like, oh, what's the way that I live? What do you think about my life? And it really reveals the deep ableism in the general public and even people who care about you or I heard that comment from adults as like a little kid. They would say that stuff to me. And it's like, you shouldn't say that to an 8-year-old. That's wild. You shouldn't say that to like a little kid who's talking about their experiences. But yeah, I definitely have had some social struggles. But you know, I I think Marfan syndrome is very important to my identity. Every person that meets me will know I have Marfan, whether by recognizing it from my build and my hands or me talking about it. And for every person that meets me and perhaps says something wrong or I was just at the bus stop the other day and a guy who spoke only Spanish was trying to ask me, why are you so tall and thin? And I ended up having a conversation with him on Google Translate, telling him about Marfan syndrome. And at the end of our conversation, he was like, oh, and he learned something new. Someone who I will never see again now knows about Marfan syndrome and maybe will look into it himself. And if I can spread awareness in that way, that might potentially lead to someone getting diagnosed, someone learning about it and telling a friend that they think might have symptoms, or just making another chronically ill person or someone with Marfan syndrome feel seen, then kind of all of that social stigma that I experienced is worth it because I'm not the only one who's experienced it. And that relatability, keeps a lot of people going. So, however much non-disabled society wishes that we weren't born or that we would leave this earth, I think us even being in this situation, talking about this, being proud of who we are, is a direct resistance to that eugenicist mindset. And, that's something that I'm very proud to uplift.
For sure. And that's the main reason why we started Invisible Illness Awareness Network and wanted to raise awareness about a lot of different conditions for people who want to go into healthcare. So this is like it's not going to be the first time they know about these things when they go to graduate school and hear about it on a single slide for like 4 minutes if we're lucky, and then move on to the next topic because there's so much they learn. So hopefully by, introducing these things when they're in undergraduate school, they'll remember it when it does stick out for that 4-minute slide in the future.
It
Um,
is it is interesting too, because I was a disability studies minor in college. My they turned it into a major after I left, which is sad because I would have done that. But I took a healthcare ethics class, and it was taught by, oh gosh, I'm forgetting her name, but she was a really notable disabled scholar, and she's has a limb difference, and so she's lived a similar experience to the both of us growing up visibly disabled. And the majority of students in that class were non-disabled healthcare pre-med students who wanted to become med students. And that class tackled like the very, controversial take of like abortion through the lens of disability, or uh, voluntary euthanasia, like all of these like very thorny topics that are very important, and very few times come from the disabled child's perspective or the disabled adult's perspective. And yeah, it's just, even having like a disabled professor do that class is like a significantly better outcome than, no one disabled being in that room. So that reminded me of that.
Well, for sure, and it demonstrates why representation is important, because we need people with different perspectives to all be at the table, right? Like, we wouldn't have like, if your professor, hadn't have been disabled, you wouldn't have had, her perspective shared with the class. Like, they wouldn't have thought about things from her point of view necessarily, because if you don't experience something yourself, it's very hard to try to teach others about what that experience might be. So that's an excellent point. Thank you for bringing that up. Um, yeah, Sarah is also a disability major, so so there's some representation there. Um, we kind of skipped some questions here, but what I know you both kind of touched on some things that you've tried for treatment options. I know, like Michaela, you said that you've gone the surgical route for OI. Uh, could you both discuss some treatments that you've tried, like what has worked for you, what hasn't worked? You don't have to list everything that you've ever done, but just some maybe more notable ones or things that have helped you the most.
Sure. Yeah. So as I mentioned for OI, there really isn't a lot. The bone strengthening medications known as bisphosphonates are marketed heavily towards people with OI, which I find ironic because they don't treat the root cause of OI, and come with a very lengthy, long list of side effects. And one of the side effects is increased risk of fractures. And as someone who fractured frequently in childhood, it makes me wonder why they would market this medication to people who already fracture frequently. But again, that's another conversation for another day. So I'm very grateful that my parents opted out of those treatments. For me, OI is unique in the fact that often after puberty, you almost practically stop fracturing. If you, I want to say if you, I don't want to say if you go the natural route, but all of the people that I know of that have never been on bisphosphonate treatments have essentially stopped fracturing after puberty. Not to say that I never could or that I never will. I'm sure I will. And that's obviously something to consider when I become much, much older. Because older people already become fragile as they get older. And then obviously I have OI. So that's something that I would need to think about, but I hope maybe someday it will be some kind of treatment. But as of right now, there is not. A prime characteristic of OI is the curvature of the limbs. So when I was about 5 years old, I had my first set of titanium rods inserted in the long bones of my arms and legs. And so I've had those replaced multiple times throughout childhood and a couple times in adulthood as I grew. Obviously, very little, but as I grew and as my arms and legs changed and things like that. And then in 2020, I had a life-saving spinal fusion surgery, and I underwent 3 months of heel traction. Prior to that, I had a 150-degree curve on the upper portion of my spine and a 180-degree curve on the lower portion of my spine. And the reason that I did not have it taken care of during childhood when you're quote unquote supposed to is because OI is when you are the weakest during childhood. And so we didn't know if my body would even be able to hold the spine hardware. And being that it's such a big surgery, even from like a respiratory standpoint, they didn't know if I would even make it off the table, like if I would be able to survive a surgery that long and that intense. But my curvature got to a point where they had actually given me a life expectancy of 10 years or less to live if I didn't do the surgery because my internal organs were becoming compressed. Yeah, it's like a real miracle that I'm here. And I just celebrated my 5-year anniversary of that, so I am halfway to the life expectancy that I thought I was gonna make it to. So I plan on living many more decades, and but yeah, so those are pretty much like all the main treatments that I've had. I do have a congenital heart defect, mitral valve as well. But other than that, those those are like the only treatments and like things that are available to people with OI that I've chosen to participate in, and then I also have pretty significant hearing loss as well. So those are kind of the things that I deal with and have dealt with in childhood. But I, as an adult, is pretty sweet because, like I said, I haven't fractured in about 7 years, almost 8 years, and so just really enjoying the freedom of like being able to be as independent, more independent than I've ever been able to be, has just been really, really sweet. And so I am loving adulthood with OI. I just feel so much stronger and just able to do so much more than I've ever been able to do.
That's awesome. I'm glad you're experiencing that. We have a question in the chat of could you explain halo traction?
Yeah, that's a great question. It's so like It's it was such a big part of my life for so long, I forget that most people don't know what that is. And then I also use my social media platforms as well to share and educate about OI in my day-to-day life. So this was a huge part of my social media back then, and it still is, obviously. But Halo Traction is a metal ring with screws that the screws are bolted into your head. So a lot of people think that the screws just go into the skin, but they actually go all the way into the skull. And so then weight is used. It's like a machine, like not a machine, like a pulley system where weight is added to slowly stretch the spine before spine surgery. And then it's also used, you're connected to the pulley system during surgery actually because it helps stretch the spine while they're operating. It also lowers the chance of, because of the severity of my curve, it lowers the chance of becoming paralyzed. Having the traction connected to you while they are actually operating. So, it is a huge deal. They only use heel traction for incredibly severe cases of scoliosis. So if you have more of a minor curve, like, please don't think you're gonna have 9 bolts screwed into your head. If you're able to, I suggest you get the surgery if you're able. If your team thinks it's a good idea before it gets to the point that mine was. Obviously for a better outcome, I had a miraculous outcome, but the surgery was really just for stability, not correction. But I do feel better and am stronger than I ever have been, and so we hope that this gives me many decades of stability and strength and just the ability to live, honestly. And we didn't know if my spine would hold the hardware, and so far I am 5 years into it, and it's holding stronger than we ever anticipated, which is a huge miracle. So it's just something that I hope to hold on to for many more decades. But Halo Traction was such a big 3 months. We did it. Usually, you only do it for 4 to 8 weeks, and I did it for 3 months. So it was a long time, but it helps me tremendously. And honestly, there's like days that I miss it because it was like so nice to have like my spine like stretched out straighter. So, yeah, I definitely miss it sometimes, but it was a huge help to me, and I'm really glad that I did it.
I'm glad that it really helped you, and I'm, again, hoping the best for you and that you get many decades of strength and stability from that. That would be great.
Thank you so much.
I did not have to do that, but I did have a cheetah print back brace when I was a child, and that was pretty cool. But yeah, so uh, Marfan doesn't really have a lot of like preventative stuff since a lot of our the risk of our condition is spontaneous issues like retinal detachment, that sort of aortic dissection, obviously. So a lot of surgeries just come with uh, either fixing something that emergently happens, or in the case of scoliosis, when your spine curves too much, they want to correct it. When your aortic root is too big, they want to preventatively replace it with a stronger material. And then sometimes folks have eye surgery. I have not had eye surgery yet, although I'm starting to consider it because I would say visual impairment is probably my biggest difficulty day to day living with Marfan syndrome at this point, now that I've had the heart surgery. But yeah, to flashback, I was actually in the clinical trial for deciding which beta blockers are best for Marfan patients. So I'm a patient zero in terms of medication treatment for Marfan syndrome. Obviously, much like Michaela, none of these medications fix the fibrillin-1 gene, although I think they're doing research into, genetic splicing and things like that. I don't know anything about it. I am not a med student. But yeah, so I was in a trial between losartan and atenolol, which are two common beta blockers. And I've been on varying doses of atenolol throughout my life. I think the max that I took when my aorta was still growing was 100 milligrams twice a day, which is quite a lot for taking beta blockers. I was very fatigued at that point in my life because the whole point of them, even though they're trendy now on red carpets to take if you have anxiety, beta blockers make you very fatigued because they're purposefully slowing down your blood pressure. So even if you're active, it'll still slow your heart considerably and won't quicken the way that it typically will with exercise in order to lower your risk of dissection. So I'm now on a lower dose of that where it doesn't really impair my day-to-day life too much, although it still slows me down a little bit. And I also take aspirin just as a mild blood thinner for post cardiac surgery. They want to make sure there's no blood clots on your the boat sail material that they replace your aortic root with. And I've also had spinal fusion surgery. I think my curve was like 80 degrees, nothing close to what Michaela had to experience. But they actually left my lower 3 lumbar vertebrae unfused. I learned recently that this was an experiment by the doctor that I saw at UCSF, where the plan was maybe it'll straighten out on its own if the rest is straight. That did not work. So I still have a 30-degree curve in my lower back. If you see me walking around, I slope kind of like this. So one of my hips is juts out and the other one is straight, which is something, I was insecure about as a teenager. I don't care as much about it now. But it's a nice shelf if I need to carry laundry or anything like that. But yeah, and then I've also wear custom orthotics. I've also always worn custom inserts for my shoes. I used to have really bulky foot braces that came up to my ankle, and now I just wear they're like a lot easier to wear, and they just slip into your shoes, and they provide support for my extremely flat feet and prolapsed ankles, which is another bone issue that Marfan patients experience. So yeah, I take daily meds. I have a lot of healed scars from a lot of mostly spontaneous surgeries. But yeah, nothing. I don't think a cure is happening. I'll be real, but nothing to treat the root cause of anything. But I've managed pretty well with my thick glasses and my medication.
Well, I'm glad to hear that you've managed well. I know it can be frustrating when, a cure might not be in sight, but like you guys referenced earlier, like a lot of people with these types of conditions, like Michaela, you mentioned like your mom and your twin having, very different presentations than you do, and you all have the same type of OI. So it's like it's hard to target, each individual case when you're, like what I'm trying to say. But I'm glad that you've experienced some support with that.
Like it's funny that me and Troye Sivan have the same thing. You know what I mean? Like
Oh my god.
so many, there's so many different people that it's like, yeah, whatever, we'll take what we can get.
For sure. I actually did not know that. It's been a long time since I've kept up with Troye Sivan.
Yeah, he I think he posted like a shirtless this is the most celebrity way that this could happen. He posted a shirtless selfie like years ago, and he got bullied because he has a pectus excavatum, very thin. And he was like, "Guys, I have a chronic illness." And everyone was like, "Oh, sorry." And it's like, well, you guys should have made fun of him. Maybe that but yeah, you know. Be
nicer.
hey. Like, be nicer. Just because he's short doesn't mean there's nothing wrong with him. But short. He's 5'8". Anyways.
Oh my gosh. Um, all right. Some final questions here. What advice would you give to someone who is newly diagnosed or suspected of having your condition? And try to keep your response to maybe 1 or 2 sentences if you can.
I speak a lot to parents with kids with OI because obviously, again, OI is something that you're born with. So by the time the parent usually already knows that their child has OI, so they're nervous about the future. But I would say don't put limits on your child and their future, because I love that I share my story on social media, because parents of kids with OI are able to see, wow, Michaela is able to do so many things. She's been featured in People magazine, been on a Times Square billboard. Like, look at all that she's doing. Like, that gives me so much hope for my child, and those are my favorite messages to receive. And so I would say just don't put limits on your child and give them the best, most fulfilling life you can. There will be challenges. I'm not going to sugarcoat that, but um, they are going to live such an incredible life.
For sure. That's a very powerful message. Thank you.
I would say similar. I think the way that I like to put it is Marfan syndrome is not a death sentence. It's very scary, but the first step to living the rest of your life is knowing. You know, it's very scary to know that you have a heart risk. It's very scary to know that your eyes might devolve, you might get worse, situations over your life, that your symptoms might be worse than mine or worse than other people's. But the way that awareness has evolved in my lifetime, in the last 20 years, has been extraordinary. And knowing is the first step to figuring out your limits, what you need to do to adapt your life and adapt whatever your dreams for your life are. You might not be in the NBA, but there are so many other facets to life and so many dreams that you can still fulfill. And, you know, whether you're a parent looking after a kid who you suspect might have it, a lot of symptoms show up in puberty, or you're that kid yourself, or you're an adult who learned after your whole life that you have it, there's still a whole life ahead of you. And our life expectancy is just as long as now the rest of the world, after being significantly shorter several decades ago. So a lot has changed. And that means that your life can change too, and you can still live the life that you want.
For sure. Thank you for sharing that. Um, and another question, if you could just make doctors know one thing about your condition, just like everyone, like right now, what would you want it to be? And try to keep a response to a couple sentences. I know that's really hard because like you want them to obviously know everything and anything about your condition. Because just like why can't everyone just be educated on it? I want everyone to know.
Be like,
But
run-on sentence. This is gonna be the longest run-on sentence you've ever heard.
yeah,
Patients are their best advocates. You may think you know the textbook science behind it, but when a patient comes to you, no matter what their condition is, whether it's or whether it's Marfan syndrome or whether it's something completely different, the patient is going to be right nearly every single time, because patients are their best advocate in their own lived experience. Patients are experts in their lived experience, and the doctors are there just to help us along the way.
for sure. You're an expert in your own body and your own lived experience, like you said. And same like Chris, you said something about like like if you feel like something in your body is wrong, like keep talking about it because no one else is going to advocate for you, right? Like they're there to help you, but if you truly feel something's wrong, you just need to keep going at it. Otherwise, you don't know what's going to happen.
Oh yeah, especially with medical misogyny, medical racism, medical ableism. Like, a lot of doctors think that they know best. Sometimes they don't, and sometimes they can be educated by the people who have lived a lifetime with this condition versus a 4-minute slide. But not to copy Michaela, I'll say something else. I'll say something Marfan specific. Aortic dissection is no joke, and you should always check for it. We were talking about the pit before we started recording, and in one of the latest episodes, this is a really cool thing to see. One of the emergency room doctors said, we need to rule out aortic dissection for a patient who had come in with heart issues by an ambulance. And another doctor said, oh, that goes without saying. And I hope every doctor in every hospital can get to the point where ruling out aortic dissection and treating it as fast as possible becomes something that they do without saying and that no one has to advocate for again in their lives. And that there are no more Jonathan Larsons that tragically die, and that, you know, the hardest thing that we have to deal with is something that doctors know, I need to deal with this right away and I will not turn you away.
When you said that, honestly, that gave me chills, and I definitely need to watch The Pit. I've not watched it yet, and you have fully convinced me. I've seen so many good things about it, but that I got chills with that. That's such a great, just mindset to be putting in the minds of people, especially I assume a lot of healthcare people like to watch The Pit. So just getting that attitude more out there, I think is super important and something that I hope that we, try to help with as a nonprofit, pushing that attitude at some point.
It's so funny, excuse me, because they say the Pit's the most accurate medical show. I'm like, I hope so. If that's the case, then everybody thinks that. So I'm hoping that that accuracy expands past, the language they used and into, that aspect of awareness. I was like, hopefully that applies too.
Yeah, for sure. Let's see. And last kind of question, if the public in general were to know one thing about your condition, what would you want it to be?
I would say to not feel sorry for people who are in a situation like mine. I get comments a lot on my social media, people feeling sorry for me and all the medical things that I have to do and go through and experience. And I always remind people that we all have challenges. Mine is just a little bit more visible. I'm not saying that my life isn't hard, but I think everyone's life is hard. But my life is also filled with such incredible joy, and I've had experiences that I would have never had if I didn't have this disability. And so just knowing that you don't have to understand my joy, and where it comes from, but you don't have to feel sorry for me. Um, and I'm happy and grateful for the life that I live.
For sure. Something that we like to say, like, at our meetings is just, like, be kind to others because you never know what they're going through. It could be a chronic illness, it could be a financial crisis, it could be the death of a loved one. Like, you don't know what someone's going through just by looking at them, and that's a great way of looking at it. Thank you for saying that.
Michaela keeps saying things better than me, and stealing what I'm gonna say. So I'll do the another Marfan specific one. I'm wearing, you can't see it. I'm wearing my Marfan Awareness Month sweater. February is Marfan Awareness Month. So I guess the simple thing, I'll parrot the Marfan Foundation. Know the signs. Learn basic information about Marfan syndrome. When you see my build in my fingers, or you see someone squinting, or you see someone, in your life complaining about chest pain, oh, I've heard of that before. Have you heard of this? Just know the signs. And knowing the signs, whether it be a bystander, your mom, yourself, your teacher, is what saves our lives when we can't advocate for ourselves. And I know Michaela mentioned earlier, having people say in your comments, like, I didn't know that this life was possible for my kids, or things like that. And the most beautiful thing about being an advocate and a visibly Marfanoid person is getting messages from, I just had a conversation with a mother in the UK, and she said, I saw your videos and I think my son has what you have, and we're going to the cardiologist next week. And it's just like, all my suffering, all my social isolation, all the stitches, all the laparoscopic surgeries, all the anesthesia, if it can save one other person and that one other person is not lost, that's the magic of what we do online, and having conversations like this. So know the signs and spread them around and like my TikTok so that other people see them and save other lives. Shameless self plug. You should like my videos. Anyways, but yeah, know the signs.
For sure. I mean, that's why we do this, right? We're trying to spread awareness, we're trying to get people to know about these things, so then we lower diagnostic delays. And just people get help sooner, and if it leads someone to a diagnosis, that's great. I think that's probably one of the most impactful things and things that have impacted me the most is being able to know that we have helped some people get their diagnoses. Like, that's such a powerful thing, like you mentioned earlier, Christopher, like, knowledge is power. Like, knowledge, once you have it, you can take the next steps with your life and figure out what works best for you. But anyway, thank you guys so much for your time tonight.
Thank you for having us.
Yeah, of course.
So much. This was so much fun.
And if you wanna have even more fun, we have some upcoming events and topics. March is autoimmune conditions. We have our meeting on Wednesday, March 18th at 8 o'clock Eastern, 7 o'clock Central. We also in April, we're doing gynecological conditions, on Wednesday, April 22nd, also at the same time, same place, same link right here. And, we hope to see you there. Follow our guest speakers. These are their handles, and, everyone have a great rest of your night. And also follow us. Follow us on social media. We post on Instagram quite frequently, at invisible_illness_network. And our website, IIAnetwork.org, has some more resources. And you can scan the QR code to find all these links, including our newsletter sign up, where you'll be notified about future meeting dates and our guest speakers that we'll have at future meetings.